Welcome back to the channel. Today we're digging into a topic that impacts nearly everyone at some point in life. How do average healthcare costs compare between the United States and the United Kingdom? And we're not just talking about national spending. We'll break down what individuals actually pay out of pocket, including insurance premiums, hospital bills, doctor visits, prescriptions, and even common procedures. So if you're curious why Americans often pay more for healthcare than Britons, or what you might expect to pay for typical services in each country, this is the video for you. 1. Before we talk numbers, let's quickly recap why costs differ so much. United States, a mixed private-public system. Majority of the population gets healthcare through employer-sponsored insurance or private plans. Government covers seniors, Medicare, some low-income people, Medicaid, and veterans. Most hospitals, clinics, and providers are private businesses. Result, individuals bear substantial out-of-pocket expenses, premiums, deductibles, co-pays, even if insured. United Kingdom. The NHS, National Health Service, is a publicly funded single-payer system, paid for through general taxation and free at the point of use. Most services, GP visits, hospital care, emergency treatment, have no direct cost to patients. Result, very low or no out-of-pocket costs for the vast majority of care. 2. Average national healthcare spending per person. Let's start at the top level. United States. Average healthcare spending is about $12,000 per person per year in 2025. Healthcare accounts for about 20% of U.S. GDP. United Kingdom. Average healthcare spending is about $4,000 per person per year, roughly $6,000. Healthcare accounts for about 10% of UK GDP. The US spends more than twice as much per person overall, but how much of that trickles down as cost to individuals is what really matters next. 3. Insurance premiums. United States. For working-age adults, average employer-sponsored insurance premiums in 2025, around $7,000 a year for individual coverage, over $20,000 a year for family coverage, split between employer and employee. For those buying on the individual market, premiums vary but average around $6,000 to $12,000 annually depending on plan, age, and location. Many Americans have their employer contribute, but their share still typically runs $1,000 to $6,000 annually just for premiums before deductibles and co-pays. United Kingdom. NHS is funded through taxation and no direct insurance premiums. Private insurance is optional. Only about 10% of people carry it. Average private health insurance premium, roughly $1,000 to $2,000 per year for an individual. For most Britons, annual healthcare insurance premiums are effectively zero or lower because the NHS covers nearly all care. 4. Out-of-pocket costs for services. Primary care visit. U.S. Around $100–300 for a routine doctor's visit if uninsured. Insured patients typically pay a copay, $20–50 depending on plan. UK free at the point of use under NHS. No contest here, most GP visits in the UK cost $0 at the point of care. Emergency room visit, US, average charge around $1,000 to $2,000, not counting tests or procedures. Insured patients face deductibles and co-insurance, often paying several $100s out of pocket. UK A&E, accident and emergency. Treatment is free under the NHS, regardless of severity or insurance status. Hospital stay per day, U.S. roughly $2,000–4,000 per day depending on hospital and location. UK free at point of use, fully covered by NHS. Childbirth, U.S. average cost for a normal delivery, about $12,000 to $18,000 before insurance discounts. Insured women may still face out-of-pocket bills ranging from $2,000 to $5,000 plus depending on plan. UK free at point of use including prenatal and postnatal care. Common surgical procedure, e.g. knee replacement. U.S. roughly $30,000 to $50,000 before insurance discounts. Insured patients typically pay co-insurance, often $3,000 to $8,000 out of pocket. UK free at point of use under NHS. 5. Prescription drugs. U.S. one of the most expensive countries for prescriptions. Average retail price for a 30-day supply of a common branded medication can range from $200–500 or more without insurance. Insured patients pay co-pays, often $10–50 per prescription, but specialty drugs can result in high co-insurance. UK prescription costs are standardized in England. Flat fee, $9 per item as of 2025. Free for children, elderly, low-income patients, pregnant women. Scotland, Wales, and Northern Ireland. Prescriptions are completely free for everyone. Even when paying, UK patients have far lower drug costs than Americans. 6. Dental and optical care. United States. Typically not included in standard health insurance. Dental checkup, $100–300. Fillings, $100 to $500 each. Glasses, $200 to $600 or more. Many people carry separate dental and vision insurance with additional premiums and out-of-pocket costs. United Kingdom. NHS dental care is subsidized but not free. Standard charges in England, 2025. Band 1 checkup, 20. Band 2 fillings, 70. Band 3 crowns dentures, 300. Eye tests, 20 unless eligible for free tests. UK residents generally pay much less out of pocket for dental and optical care than Americans, though these services aren't as fully covered as core NHS healthcare. 7. Annual out-of-pocket spending estimates. Typical person. Let's summarize what the average individual might pay out of pocket annually. United States, premiums individual, $1,000 $6,000. Deductibles, $500. Copays coinsurance, $500. Prescriptions, $300 $1,000. Total often $3,000 $10,000 per year for insured individuals. For families, this can easily exceed $20,000 annually when premiums and out-of-pocket costs are combined. United Kingdom, no insurance premiums for most. Free GP visits, hospital stays, childbirth. Prescription charges capped at 9 per item, or free in devolved nations. Dental and eye care, modest out-of-pocket costs, $100 to $300 per year for many people. Total out-of-pocket healthcare costs for a typical UK resident might range from $100 to $500 per year for healthcare-related services, dramatically lower than in the US. 8. Hidden costs, taxes. It's worth mentioning that NHS funding comes from general taxation, so Britons pay indirectly. For example, UK income taxpayers contribute around 20% basic income tax, plus national insurance at around 12% on earnings above $12,000. These taxes fund the NHS, so there's no separate health tax, but healthcare is part of overall government spending priorities. In the US, no equivalent universal system, so healthcare funding comes directly from individuals and employers via insurance premiums, copays, and out-of-pocket payments. The US effectively relies on private health taxes in the form of insurance premiums, while the UK integrates healthcare funding into broader taxation. Summary. Let's recap what we've learned today about average healthcare costs. The US spends more than twice as much per capita on healthcare as the UK. US residents face high individual costs, premiums, deductibles, copays, prescription drug costs, dental and vision care expenses. UK residents, no insurance premiums for most. Free at point of use for nearly all essential care. Small out-of-pocket charges for prescriptions, dental and optical services. A typical American might pay thousands of dollars annually in healthcare-related costs, while the average Briton pays a few £100s at most, and nothing for primary or emergency care under the NHS. That's it for today's deep dive into average healthcare costs in the USA versus UK. If you found this video helpful, subscribe and turn on notifications, because we've got more useful comparisons coming soon, from taxes and student loans to retirement savings and business loans. And let me know in the comments, how much are you paying for healthcare where you live? Do you think a tax-funded system or an insurance-based system works better? Thanks for watching, and I'll see you in the next one.